Hi, can you hear me?
Hi, Tricia. Yes.
Hi, wonderful. Would you like me to wait for a few minutes before people join? More people join?
I think we should start at 5:10. That will be
Oh,
10 minutes. Wait.
okay.
Yeah, it's 5:07 now. It's 3 minutes more.
Okay, sounds good.
Okay.
Hi, everyone. This is Tricia. While a few people may continue to trickle in, thank you for joining for day 2. I wanted to start today and have an opportunity for you to ask any questions based on what was brought up during yesterday's session. You can either unmute yourself or put your question in the chat box. I'm going to suggest that we proceed if there aren't any questions from yesterday. And if you do think of questions, feel free to type them in the chat box, and we can revisit them also at the end of the session. Oh, thank you. Someone said you do not code in Python. How do you make analysis of your data? So I use RStudio. It functions quite similar to Python and is also free. RStudio is also more well known in the data visualization space. Other platforms that are used in data visualization, particularly for journalism, is D3, which is a JavaScript-based program. I do not use D3. Partially, I haven't bothered to learn D3 because my work focuses primarily on data visualization for policymakers. And because policymakers are accustomed or expect data visualization products in paper-based formats and reports and presentations, D3 focuses on interactive data visualization. So you'd see D3 more so if you go to Reuters or New York Times, where they have highly interactive data visualizations. The data visualizations that you can produce in D3 are quite beautiful and interactive, but I think one consideration to keep in mind is they do require steady internet access, which is a bit more challenging in settings that have variable internet access. I also can code in Stata, but Stata is not known for data visualization and data visualization capabilities. Primarily, I use RStudio also because there's a lot of internet supporting blogs and resources whenever you have a question about how to create a certain type of graph in RStudio. There's a whole package that's focused on data visualization for RStudio. So that's why I have chosen R. Thank you for your question. Can you see my slides? Power BI. Thank you for bringing this up. So Power BI and Tableau are both data visualization tools. I would consider a data visualization tool a program that you can use to create a data visualization or a dashboard, a scorecard. Tableau and Power BI, I believe both cost money. And so I don't use Power BI because I do not have a subscription, but I have looked at it in the past. Tableau, I think I mentioned this yesterday, there is a Tableau free version and a Tableau Public. Tableau Public is the free version, and you have access to all of the functions of full Tableau. The actual Tableau license is extremely expensive, and so I only have a Tableau license because I'm an educator and I have done workshops with it, but on my own, I likely would not purchase a Tableau subscription because it is prohibitively expensive. Tableau is very nice, though. At the end of today's session, I'll have links on how to create these graphs in Tableau Public. So the main distinction with Tableau Public, other than Tableau Public is free, is that you cannot save your graphs or your dashboards to your own computer if you use Tableau Public. They are saved in your online account within Tableau. However, you can still download the graphs similarly and use them for presentations. So that's just the only difference with Tableau. Another option is Google Data Studio, which is free if you have a Google account. That is another data visualization tool. So these three tools, Power BI, Tableau, and Google Data Studio, all three do not require coding. So that's an advantage for some individuals who do not want to learn to code, or it's a bit more unnecessary for their work. But Tableau is an interesting case because I think you see a lot of public dashboards that are built with Tableau that are used by global health bodies, such as like WHO and Unicef. If you go to the Unicef data site, I believe it's all Tableau dashboards. There are some pieces of WHO that used Power BI dashboards, but I've noticed that that's more rare. Great. So I'm going to open up my slides now. Can someone confirm that they can see them? Okay, great. Thank you. Thank you for helping me. Let's go back to the slide view. Okay, so in terms of day 2, we are going to continue discussing types of visualizations that you can easily make within these categories of key messages that I've identified. And these are, again, key message categories that are the most frequent that will come up when you want to convey something in your work. So I've looked to start off for today, the first thing that we are going to talk about are comparisons in which one number or numbers compare to a total. And so I'm sure you're all familiar with pie charts. Pie charts are circular charts that are split into segments where the proportion of a slice and the number of cases is representative of that amount of data. A proportion is a percent of the total that slice represents. And commonly, different colors can be used to identify various slices. Pie charts can be very polarizing, where people like them or they hate them. And the people who hate them really hate them, and the people who like them really like them. So there are very strong opinions on when to use a pie chart. For me personally, I don't think pie charts are bad. I even have a t-shirt that I wear to do training sometimes that says a pizza is a live pie chart of how much pizza you have left. So I am not against pie charts. I think you have to be mindful of when you have a lot of slices. So I'd like you to think about the example that I showed you from day one of the global burden of disease comparing females and males. And those were two pie charts that had a very busy number of slices. So it's a little challenging to see the differences between the slices. You also shouldn't use a pie chart for comparisons. So that's a pie chart versus a pie chart, which I'm sure you've seen before. And it was like the example I showed you yesterday. Why you would never use pie charts for comparisons is because our brains have more difficult times looking at many different planes. So I think I mentioned this yesterday, our brains are attuned to look up and down and left and right in straight lines and 90-degree angles. As a result, if you have two pie charts next to each other, it's an additional effort for your mind to look at the two pie charts and compare the different slice wedges. It's very, because when you're interpreting a pie chart, you're looking at both the angle, so along the center axis, how big is that wedge or that slice? And then you're also looking at the arc of the pie chart. So that's the part that surrounds the circular part. So here's an example of an alternative to a pie chart. So this is a stacked bar chart. What this graph is showing is the number of lives saved by intervention group in mainland Tanzania. So from 2000 to 2015, the government of Tanzania and partners tried to improve these interventions, expand these interventions. So because more people could reach, more people in mainland Tanzania were reached by these interventions, and thus more lives were saved. So these interventions are purposely selected because they are high impact, as in they save the most amount of lives. So we have bars going from 2000 to 2015. Each bar, the length of the bar, represents the total number of lives saved that year. And then within each bar, we have different colors to represent the different intervention groups. Using this approach, our brains can look left and right, up and down, and we can observe that first, the total number of lives saved per year is increasing as time progresses, which is something obviously we would like to see. We also notice that the width of the colors change over time. So if I'm looking at the purple, for example, the purple takes up a pretty big amount of space of that rectangle. And you'll notice that in some years, the purple rectangle is, bigger than other colors within that year. So in 2005, the purple is larger than any other color. So if I look at the legend, I'm noticing that interventions that were focused on reducing stunting and wasting. So these are nutritional status indicators where stunting is too short for age, wasting is too skinny for age, where intervention focused on these interventions focused on reducing stunting and wasting contributed to a lot more of the lives saved that year. In later years, like in 2015, you'll notice that this dark gray, so that's malaria prevention and treatment, is about the same size as green, which is vaccines, and the purple, but the purple is a little smaller. So we can say in 2015, in this year, the interventions that contributed the most to saving lives in mainland Tanzania were malaria prevention and treatment, vaccines, followed by reduction in stunting and wasting. So again, this is a stacked bar chart, and the alternative to this option would be having 15 individual pie charts representing each year. And you can also imagine, looking at 15 pie charts could be quite overwhelming. But if you visualize this data with 15 pie charts, you also would lose the information of total number of lives saved, because you wouldn't be able to show that within the pie chart for each of those 15 pie charts. This is another example of an alternative for a pie chart. In this case, an alternative for doing a pie chart versus pie chart. This is called an 100% stacked bar chart. And this particular chart, which is from our Tanzania study as well, shows the distribution of under 5 deaths in mainland Tanzania as estimated by the LiveSave tool. And just another note, the LiveSave tool is a projection tool used in global health to project both mortality, so the number of deaths, and also the attribution of specific interventions towards saving lives. So in this example of the 100% stacked bar chart, there is 1999 DHS and 2015. So each bar represents one of these survey years. And similarly, our brain is attuned to looking up and down and left and right. So up and down, we notice that this blue is about the same for both years. There are more differences in some of the other colors. So I'm looking at AIDS. In 1999, AIDS contributed to 7% of the under 5 deaths in mainland Tanzania, whereas in 2015, it contributed to 0.9%. So again, I'm looking at the length of this color block and noticing how, hey, in 1999, it was quite larger than in 2015. You can make similar judgments of looking at the colors and comparing the sizes by looking up and down. For example, another judgment I could make is from this graph, it looks like diarrhea caused about the same number of deaths for both years. The green is the same length, and the estimate numbers is 10.4 and 10.5. Another example of something that strategy you could use is something called a proportion plot. And so on each side of this plot, there is one variable. This particular example is from Stephanie Evergreen, who is a data visualization expert, and this is from her website. She is showing how Black and Hispanic people in the US are disproportionately killed by police. If the justice system had no bias, the shares of both would be the same. So on the left side, we have share of deaths by police, and this is separated by race. So for Black Americans, it's 44%. And on the right is the share of the population as part of the US population. So in this case, the share of the Black population in the US is 13%, and yet 44% account for the share of deaths. Proportion plots can be made in Excel. And if you look on her website and on her blog, she has instructions on how to make this type of graph. Another thing I wanted to flag when talking about comparing different proportions is sometimes there are very quick wins that you can do in order to improve your data visualization. In this example, so in the past year during COVID, Johns Hopkins has been quite well known for their online dashboard. So there was a global dashboard that accounted for the number of cases and such. And then starting in April 2020, they began releasing these fact sheets on each county within the US. So this is, so within each state, they had a fact sheet for every county in that state. And the purpose of the fact sheets, they call them status reports, was to show a snapshot of what that county was like at that time. So on the left side on the slide is the first version of the status report. The right side is their updated version. So when I saw the first version, I thought, hey, I think there's a lot of wasted space on the status report, and they could fit more indicators if they change some of their proportion graphs. So on the far left, on the original version, it shows health facts and infrastructure. And so this visualizes, it visualizes health insurance. So the purpose of this graph is to show, what type of health insurance do people in this county have? And it's separated by population. It's a bit hard to see also with the colors. The color scheme is not great to show a lot of distinction among the different categories. So I can understand if some of you also have trouble seeing that. The middle graph is population. So this is the population breakup by race and ethnicity within that county. One thing I had flagged for them is this pie chart does take up a lot of space within their status report. If they replace this pie chart with a stacked bar, 100% stacked bar chart, they would be able to fit in more indicators. So this is what they did, and that's what you see on the right side, where instead of just race, they added a breakdown of ethnicity and also age groups. So again, I'm showing you this example because sometimes when you are working with your bosses or other stakeholders or your team, there might be on iterating and improving your data visualizations, there can be quick things that you can do to easily improve your product that don't necessarily require a lot of investment in time. And so in this example, it's just converting these some of these graphs into new types of graphs, so there is more space within the page. I'm going to pause here for a bit. Does anyone have any questions on that section? Just looking at the chat now, in terms of graphs drawn in Tableau, at the end of the presentation, there will be a link where I have created tutorials on how to create these graphs in Tableau. So you can follow those tutorials at your own free time and then reach out to me if you have any questions. I'm going to move on to the next section. Feel free to add additional questions within the chat. So the next section, and is the next main section that I will share with you, is how numbers change over time. And so all of you are familiar with a line graph, and usually that is what you should use. In a line graph, the x-axis is frequently used as the continuous variable of time. And so on the left side is an example of under 5 and newborn mortality in Tanzania, where each line represents a different, one line represents under 5 mortality, another line represents neonatal mortality. Another option, which is a type of line graph, which I also mentioned to you yesterday, is a slope graph. So you could use a slope graph if you have only 2 years. And so you'll notice on the right side, there's 2010 and 2015. This is data from the DHS, and it's comparing overweight and underweight. And again, a slope graph is a good strategy because our brains are tuned at looking at slope and commenting and responding on whether or not a line is increasing, decreasing, or staying the same quite quickly. Here's an example of combining multiple strategies. So this graph is from The Economist, which is a magazine. I think it's based in the UK. And so the title of the graph is Why Vaccine-Shy French Are Suddenly Rushing to Get Jabbed. The government's decision to allow only vaccinated to enter restaurants, bars, trains, and other spaces has caused a spike in inoculations. So on the line and the bars help show how at this point after July, after the policy went in place, the number of COVID vaccinations increased dramatically. And so that's what they're conveying with both the line and the bar. So the bar represents, the bar is the number of total vaccination appointments. And then the line is a moving average. An area chart is a type of line chart that takes into account proportion. So on the left side is a graph that shows the number of COVID vaccine doses administered by manufacturer in the US. So currently in the US, there are 4 different types of vaccines that are being administered. And so this graph shows that over time, there's an increase in almost all of the vaccine types, and then the divide in proportion where there's a bit more individuals in the US that have received Pfizer than Moderna vaccines by April 15th. On the right is a graph that shows the COVID vaccine doses administered by continent. So this is an area chart, but a 100% area chart. So it's taking into account a 100% proportion. And so it's similar to the 100% stacked bar chart, but it incorporates this element of time. So you'll notice that Asia, North America, and Europe have taken a majority of the COVID vaccine doses that have been administered, whereas Africa and South America are quite small. Okay, so I'm going to show another case study, and this will work like yesterday's case study. So here's an example of an article from Citizen Digital. And the article was called, the title of the article was Tanzania President Samia Suluhu says, should allow all pregnant schools back to school. In the body of the text, it says teenage pregnancies are on the rise in Tanzania. The 2015-2016 Tanzania DHS found that 1 in 4 women aged 15 to 49 or aged 15 to 19 are mothers. So I have pulled out this data for you. So this is the statistic that they're referring to for 2015, DHS 2015-2016. This 27% they're considering 1 in 4. And then I pulled out the data for you from 2004 and 2010. And so I'd like you to think about what type of graph you would use to communicate this. The fact that teenage pregnancies are on the rise in Tanzania. You can type your response in the chat box, or feel free to unmute yourself and share with the other participants.
Can you repeat the question?
So the question is, what type of graph would you use to communicate that teenage pregnancies are on the rise in Tanzania? The 2015-2016 DHS found that 1 in 4 women aged 15 to 19 are mothers. So that's the actual sentence from the article. And so my question for you is, what type of graph would you choose to communicate that? And I've included the data below. we'll wait until the rest of the participants have finished typing. Teams gives us a notification that someone is typing, so we'll wait for them before moving on to the next exercise and discussing. But thank you so much for sharing your opinion. Oh, maybe the person changed their mind and doesn't want to type anymore. Oh, it's so while that person is finishing up typing, I will say that most people seem to have suggested a bar graph. A bar graph is a plausible option, but one thing to keep in mind is the key message suggests that there is a comparison of time, so that the key message is related to time, in which case using a line chart, just a simple line chart, would make sense, because you would only need to show 3 different data points and to show, this trend. The interesting thing is, based on the actual data, teenage pregnancy was actually higher in 2004 than in 2010. So it decreased in 2010 and then increased again in 2015, 2016. Because there are only 3 estimates, a bar chart is an option. I wouldn't say it's a wrong option, but it's an option because you only have 3 estimates, and so I think it's an acceptable choice. But because there is this dimension of time that it's emphasizing of the change in pregnancy over time, that is why I would be inclined to choose a line graph. In terms of other options, like a stacked bar chart or an area chart, so both a stacked bar chart and area chart emphasize proportion. And it's not necessarily needed to use a graphic that shows proportion in this case, because the key message doesn't talk about women who are not adolescents. So the key message only focuses on women age 15 to 19 that are mothers. And so the other groups are not mentioned in the key message. Therefore, we don't necessarily need to show the proportion, but it is an option, particularly if you want to show as your key message. So this is not specified in the news article, but let's say the news article did want to emphasize what proportion of those women that are becoming mothers for the first time are age 15 to 19. So DHS does report first-time pregnancies for different age brackets. So let's say the news, the newspaper, the news agency wanted to relay that and to share, what proportion of these mothers are 15 to 19, in which case using an area chart or a stacked bar chart would be a more appropriate option. Okay. I'm going to proceed. So another category that I wanted to bring up is when one number is very important. It sounds very silly, but as humans, we have a very short attention span. And so sometimes when you want someone to remember a number, a strategy could be to make that number bigger, or use a different font, or use a different color. And so you're highlighting, individual numbers for more impact. Here is an example on the right from the annual WHO UNICEF World Bank Joint Malnutrition Estimates. This is the report that they release every single year. So the size of the fonts are related to the proportion of children within that group. So the third set of circles, from the top represent children in lower middle income countries. And then the circles at the bottom represent children from low income countries. So these income statuses are set by the World Bank every year for each country in the world. So you can go to the World Bank website and look up, what income status each country falls under. The numbers in this third row for low middle income children in low middle income countries, the font size of the estimates is larger. And it's done on purpose because these children make up a greater proportion within that line. So the first line, we have just looking at the number of children in the world under 5. So all children under 5 in the world by income, where they live. So in 10% of the world, 10% of children under 5 live in high income countries, which is a lot smaller of a proportion than 45% of all children under 5 live in low middle income countries, and 16% of all children under 5 live in low income countries. So this is the purpose of the black is to just show the distribution of children in the world by income status. The 3 lines on the right represent stunting, wasting, and overweight. So for stunting and wasting, we see that the biggest circles are this third group, which is low middle income countries. So the most children under 5 who are affected by stunting and affected by wasting live in these low middle income countries. For the last line of overweight, the highest number of children affected by overweight live in upper middle income countries. So this is why this circle is a bit bigger. This is another example from Reuters graphics using symbols to represent only 2 colors to represent a high impact message. So this graphic was prepared in March 2020, and the purpose of the graphic was to show how in one area in Italy, in Lombardy, the number of deaths in one weekend from COVID, so this block of orange on the far left, was so much more noticeably bigger than the rest of Italy, the number of deaths in Spain, number of deaths in the rest of the world and in other countries. And so this is a very easy visual example of conveying that key message of how the number of deaths in this one area of Italy was much higher than in other parts. So in my final category of the presentation is other tips I have for you on how to format your data visualizations. So the first thing I want to address is confidence intervals and communicating uncertainty. You might remember from learning in secondary school or university this concept of confidence intervals. And when you have an estimate, you can be, for example, 95% confident that your estimate falls within a certain range. When you are thinking about your own data visualization, the first thing to think about is consider your audience. Most of your audience does not understand a confidence interval, and you do not want to confuse your audience. When we did the study in Tanzania, one policymaker said to us, showing a confidence interval is like pouring water in a sack. So in other words, what's the point? So think about your audience, but also what is your key message that you need to convey? If you do feel like you need to convey statistical significance, you must be able to explain it. And you should explain it in terms where where more people are likely to understand it. So here are some examples of how to explain confidence intervals and statistical significance in more easier terms. Statistically, the trend shown did not happen by chance. There's a statistically high chance that the actual number falls within this range. On the right side are 4 examples of conveying confidence intervals. And in this study, they tested people's ability to interpret each of the 4 examples, and the one circled with the shaded region was the most successful in terms of people understanding how to interpret it. Here's a Tanzania-specific example of maternal mortality in mainland Tanzania. So it's a line graph. These bars represent confidence intervals. So I'm going to pause and ask you in the chat to please share what you think is the key message from this graph. So again, looking at this graph of maternal mortality in Tanzania, what do you think is the key message from this graph? If you have no clue or no idea, feel free to add that in the chat as well. Great, so someone stated a maternal mortality trend. Thank you for being brave and sharing your thoughts on the graph. So while other people are typing in the chat, I'll just give you some more background on this data. So maternal mortality means that a woman died while giving birth. It is one of the Sustainable Development Goals to reduce maternal mortality. In Tanzania, the official maternal mortality statistics come from the National Bureau of Statistics, and so that is through the DHS. So here we have 3 years of DHS and also the population census, which is conducted by NBS as well. In Tanzania, also as background, the government has set a target to reach 193 maternal deaths per 100,000 live births in 2015, by 2015. So you'll notice that there's a little symbol of a target for 2015. I'm really pleased to see more activity in the chat. One individual said from 2005, the maternal mortality was decreasing, but from 2012, there has been an upsurge in maternal mortality. And again, someone noted a decrease from 2005 up to 2012, and the increase to 2015, the fact that it was much higher earlier and then went down and up. So one thing I want to point out in the individuals that have been sharing their reactions to this graph is they are reacting on the slope of this graph. Now, as I mentioned to you, that's what our brains are tuned to look at. If a line is decreasing or going up or going down, and that's what these individuals have shared. Going back to this chart, as I mentioned, these lines, these rectangular lines, are confidence intervals. And when NBS, when any statistic survey is done to get an estimate for indicator, it is an estimate. So how surveys work, as you know, is you sample. So you ask you don't ask everyone in the country, you ask a representative sample, and then using statistics, you make sure that it can be nationally representative. So you don't actually get the true estimate, but your objective is to get as true as possible, which is this 95% confidence interval. So in the 2005 DHS example, we're saying that we are 95% confident that the actual estimate for maternal mortality falls between 466 and 690. So when the 2015 DHS came out, it was very politically shocking because the number was 556. The estimate was 556. If you are a politician in Tanzania, or if you are a public health official, you do not want to hear that maternal mortality is increasing. After all of the efforts over the past 15 years of reducing maternal mortality, you do not want to see the number increase. And so when the 2015 DHS estimates came out, it was very politically sensitive because, the government doesn't want to see this increase or have to relay, oh, there's been an increase in maternal mortality is getting worse. However, this is a case when visualizing the confidence intervals is extremely important, because if you compare the 2010 DHS and the 2015 DHS confidence intervals, so again, it's the rectangular gray line, there's overlap. So because there is overlap, this means that there is no statistically significant difference in maternal mortality between 2010 and 2015. That is a more acceptable finding, politically acceptable finding of no change rather than an increase. So again, this is an interesting example, particularly in Tanzania, of why it's important to convey confidence intervals when it comes to maternal mortality trends. Just because there actually was not an increase in maternal mortality, statistically, there was just no change between the 2 years, which also is not great, but it's not as, the message is not as bad as it got worse. Here's an example of visualizing confidence intervals by the New York Times in the US. So these are different COVID models. So these are different groups: Northeastern, Johns Hopkins, Imperial College, MIT, Columbia, IHME. And these are different groups that have different COVID models to forecast deaths. So on the left are the line estimates. So these are just, the actual estimates that these groups have put forth. However, as I mentioned, the estimates are just estimates. And so when you look on the right, the shaded regions are the confidence intervals of what we think reality falls in. And the funny thing is with this, the green is huge. The shaded green region is huge, which suggests, we have no idea with this particular model. There's so much range and possible inaccuracies in this model. And then also looking at the blue, the shaded region of blue even extends into the text of the article, which is almost, it's comical. And it's like they're trying to make fun of them, that the confidence interval is just so huge, the unknown, that that it's funny that they are operating in that. So, of course, our interest is to have a smaller confidence interval when doing forecasts, because we have greater confidence that the actual number falls within that range. Other tips that I wanted to share with you are color. So red and green are actually the most common color blindness, and we have no good estimates of global color blindness and color blindness in different countries. So it's something to keep in mind. In some settings, for some companies or some newspapers, red and green is part of the color scheme, so you cannot really avoid it. But in which case, you should consider integrating patterns to make the graphs more colorblind friendly. When we did the data visualization study in Tanzania, many policymakers mentioned that they were colorblind or their colleagues were colorblind, which was an interesting, unexpected finding, because I think when you're in meetings, you don't necessarily hear from someone that they cannot read a graph and that they're colorblind. It's, I think people are not as open about sharing that. So it was an interesting finding. On the right is an example of using color to highlight a key message. This is from The Economist. which is the magazine based out of the UK. And the purpose of the red is to show how the country Bhutan vaccinated almost all of their adults in 1 week. So that's displayed in red and compared to other countries which are in a similar color palette. Another thing to keep in mind is to make sure that your axes are accurate. So this is the same data, but you'll notice on the left side, the years are evenly spaced, even though there isn't an even number of years in this continuous variable. So on the right side, the x-axis is fixed so that the values are spaced according to the gaps between the years of data that's represented. Remember to press the Shift key when resizing images to retain image proportions. Sometimes if you do not, they get squished, and then that makes it more difficult for these graphs to be interpreted. Don't assume that your audience can interpret things on their own. One of the data visualization, he's considered a leader named Tufte, who's a professor, has talked about never underestimating your audience. But in my work, I found it equally dangerous to overestimate your audience and to assume that they can understand any dashboard or data visualization that you give them. So this is an example of Unicef. They have these annotations, this annotation guide that describes to individuals how you can read this dashboard. So in this case, they use Tableau, and they have left annotations to describe what you would to click on to view different things. This is another example of annotations that's used by the New York Times in the US that explains how to read these dumbbell plots. I mentioned dumbbell plots yesterday. And so these pop-up boxes, so in this case, it's a box that hovers on top of the graph. They show up to help the audience understand how to read this graph. Finally, you have an ethical obligation to visualize data accurately. And so this is an example in the US of at the beginning of the COVID pandemic of Trump telling the US that it wasn't so bad with the case fatality rate. And also another time where he tried to change the trajectory of a hurricane using a marker on the right side. And so I bring this up because as a professional, you have the obligation to visualize data accurately. And unfortunately, data is not as objective as we would think. People are inclined to show specific indicators or omit certain indicators because it supports their point. And so it's something to keep in mind in how you should ethically visualize data. This is a link to all the Tableau Public tutorials that I've created to make the graphs that I've shown in this training today. And I've included additional reading for you to refer to if you want to learn more. So I just want to go back to this exercise. If you remember that we started day one with this, where I showed you 3 different ways to visualize the same data set, and I gave you one key message. So I'm going to pause here, and in the chat, feel free to comment what option you think is the best option to visualize this key message. So the chat is quiet, and in the interest of time, because we are running out of time, I'll remind you that, thank you, Janice. I'll remind you that most people chose 2 or 3 when we started. So I will say, I did mention in training today, you should never use a pie chart versus a pie chart, because our brains have a difficult time comparing arcs and angles at the same time. And our brains look left and right and up and down. in this particular case, in the example 3, I will say that because there are labels in most of the wedges, and because there is some variability among the wedges, so not like the first slide I showed you of all those tiny slices, I don't believe 3 is that bad. However, 1 is the superior option because, as I mentioned, our brains quickly look up and down and left and right. 2, I would say, is the least best option, just because the key message emphasizes proportion of different causes. So proportion of under 5 deaths attributed to AIDS and such. And so a bar graph like this doesn't necessarily show proportion, so a number as part of a whole. It does show estimates, however. So I'm going to quickly go to the final example that we used yesterday. So again, 3 different ways to visualize the same data, and the key message was ANC varies by household wealth. So feel free to share in the chat if you have a preference for one of the 3 graphs, or if you had a preference and you feel like it's wrong, but you still are staying strong, feel free to share that as well. Okay, so we have a couple for number 2. Thank you for sharing. So when we did this yesterday, most people chose number 1, which is fair. I think, so option 1 is all regular bar charts to show differences in wealth. However, I would say in this example, and particularly when visualizing equity, it's a better strategy to use dot plots because, again, our brains are very good at looking at length of a line and the space between those dots, and that space represents inequity. So looking at the varying lengths of bars in option 1, it's more challenging to see to judge, the difference in estimates between and among wealth quintiles. So that's all I have for you. I'm going to stop talking. Does anyone have any questions they'd like to share? If so, you can unmute yourself or comment in the chat.
Thank you, Tricia, for the good presentation. I asked Area from the chat box about a dashboard. Is it something that a data analyst should learn how to design and use when presenting the analysis?
Yes, I'm sorry I missed your question in the chat box. So I will say that people love dashboards. Unfortunately, I think the world is filled with a lot of dead dashboards. So when I use the term dead dashboards, it's a dashboard that no one uses and is dead. So I think people have a lot of great ideas and they think that creating a dashboard will solve all their problems. However, more frequently than not, and I work with a lot of stakeholders in different countries to create dashboards, more often than not, what happens is the dashboard is created and then no one uses it, which is very sad because you put in all of that effort to create the dashboard. So if you have been tasked to create a dashboard, or if you want to propose a dashboard, my advice to you is to work with the audience who is expected to use the dashboard to identify what information, what indicators should be collected. And it's also important to recognize what those indicators will mean, what meaning they can gather from those indicators, and what message will they get from that indicator. Because if you put together a bunch of many different indicators that don't really have a connection, the dashboard is less useful than if you treat the dashboard like an experience to tell a story, where you have chosen different indicators to show a different aspect of a story. So again, whenever you create the dashboard, you should always do it in partnership with who you're expected to use it. And you also need to think about what types of graphs should I use so someone can understand this dashboard. One mistake that I see commonly is people will choose the coolest or the fanciest looking type of graph for a dashboard. And this is done with data visualization in general. However, they don't account for the fact that someone might not be able to interpret it. So one example is with one dashboard I've worked on, they use a lot of bubble charts. And people notoriously have a difficult time interpreting bubble charts. They might look very cool, but if someone cannot interpret it, it's very challenging. So that's the second point I would make sure that you choose the right types of graphs for the dashboard. And then my third and final piece of advice is to work with the audience to come up with a plan for updating the dashboard. Because what happens a lot is, a government that I work with or an NGO, they are very excited about launching the dashboard, and then nothing happens after the dashboard is launched. And that's when it becomes dead because it's never updated. And then in which case, no one's going to use it. But I think this idea of learning, of how to make a very strategic, good dashboard is a very valuable skill. And many people, I think dashboards are very hot and many people want them, but it's also an important skill is also to make a dashboard that people will use. I hope that was helpful.
Yes, thank you.
Are there any other questions?
I've got one question.
Great.
For your data analysis, which tools do you usually use? Is it R or you've got other tools that you use?
I use R for data analysis as well. However, particularly from your background of the people who have participated in this training, you might not be public health or global health or doctors who have a medical background. So it wouldn't necessarily make sense for you to calculate your own indicators. When working with health data, it's important to keep in mind that there are standard indicator definitions that are used on a country basis, so nationally and also globally. And in many cases, they match. So, the Tanzania Maternal Newborn Child Health Strategy, the indicator definitions will likely always match the WHO Unicef definitions. If you look at DHS, and again, this will become relevant to Tanzania, especially in journalism within the next year into when the next DHS comes out, since they are currently doing data collection. DHS has a GitHub that has their code. They're working on sharing their code. So if you are comfortable enough with using GitHub, you can look at the code that they use to calculate indicators. However, if you also, do not feel the need to calculate the indicators from the raw data yourself, DHS always summarizes all estimates in a report for each survey. So the data that I took for you for the case studies in this training are all from the Tanzania DHS reports. So that's your second strategy. You can look at the reports. A third strategy, on the DHS website, they have something called Stat Compiler. And it's an online tool where you can select indicators, select countries, and you can create your own tables of data that you can download as a CSV. You can also make bar graphs and line graphs within the website. So that's a third option of getting the data. So not necessarily data analysis is necessary. And actually, these examples of DHS data that's been used by Tanzania media, those are all estimates that people lifted from the reports. They did not calculate that themselves.
Thank you.
You're welcome. Are there any other questions? Feel free to send me any questions you might have over email afterwards if you think of them. Thank you so much for attending the training and for dLab for organizing this. I hope you found it useful. And if you do have any questions later, feel free to reach out to me.
Hi, Tricia. This is Somoe from Tanzania dLab. We thank you so much for facilitating this session, and I hope everybody has followed it from day one to today. And we are grateful that you have used the vivid examples of the current health situations in the world. So we thank you so much. And should we have maybe other requests to assist us in maybe facilitating some of the programs that maybe will be required by most of the participants, then we argue to be ready for our request.
I don't think I'm enough of an R expert to lead an R training. However, I do recommend that everyone following, actually, I will put a link in the chat to the website where you can see my Tableau trainings. And I do recommend that you look at them and see how it goes. The focus is on nutrition data, but the trainings are applicable if you have never used Tableau before and want to use your own data. It's not necessarily nutrition specific. It's only how the tutorials were organized. So in the chat right now is a link to the tutorials, and so feel free to look at them and let me know how it goes.
Thank you very much. Thank you. For the side of participants, thank you for your time. Thank you for joining the sessions, and we hope all that we have learned will be put into practice. And do not forget to follow our social media accounts, because there are a lot of opportunities that are being shared through the social media accounts. So please follow us and take the opportunities that we will be sharing on the way forward. Thank you so much.
Thanks.
Thank you, Tricia.
Bye.